Welcome to Topic Tuesday. Topic is Radiography in Pediatric Dentistry Part 2, and today we will talk about radiographic techniques. Four type of radiographic techniques used in pediatric dentistry: intraoral radiographic technique, specialized radiographic technique, extraoral radiography, and digital radiography. Intraoral radiographic techniques include periapical and supplementary. Periapical include paralleling and bisecting, and supplementary techniques include bite-wing, occlusal, and specialized bent film technique. Specialized radiographic techniques include xeroradiography and scalography. Extraoral radiography include panoramic radiography, skull projections, and hand wrist radiography. So starting with the intraoral radiographic techniques, in this technique image detector placed inside the mouth, that's why it's called intraoral technique. Intraoral techniques include periapical technique, and in periapical first is paralleling technique. So X-ray beam parallel to the long axis of the tooth, that's why it's called paralleling technique. In this technique, central ray or X-ray beam should be perpendicular or right angle or 90 degree to the long axis of the film. It is also known as a long cone technique because long cone is used, and Fitzgerald technique because Dr. Jordan Fitzgerald was pioneer of this technique. In maxilla, superior border of the film should be rest on the palatal vault, and in mandible, inferior border of the film should be rest on floor of the mouth. In bisecting technique, film placed close to the mouth and central ray right angle to the line bisecting the angle formed by the plane of the film and the long axis of the tooth. It works on the Szymanski rule of isometry. It was introduced by Weston Price in 1904. It is also known as a Miller's technique because Dr. Charles Miller developed this technique. It is also known as a short cone technique because short cone is used, and there are angulations for maxilla and mandible. In supplementary technique, first is bite wing. Howard Rapper 1925 introduced this technique. Both maxilla and mandible is recorded in the one film. Size 1 should be used for children and 2 should be used for adult. It's basically used for interproximal caries to check bone level and dental restoration. Occlusal radiography is also known as a jaw radiography of large lesion, and the third is specialized bent film technique, which is exclusively for children. And extraoral radiography, in this image detector placed outside the mouth. In specialized radiographic, xeroradiography, in this technique use photoconductive plates made up of selenium that gets charged then exposed to X-ray, create electrostatic image on the plate that develop using toner powder to make image visible. 9.5 into 4 inch plate is used, and the second is salography. So radiography for salivary glands. Stay tuned. Thank you.